Thank you so much for making time out to watch Sound Health on Lagos Television. Today on the show, with the help of an obstetrician and gynecologist, we will diagnose a hormonal disorder known as polycystic ovarian syndrome. I'm Olasumbo Modupe. Please stay with us. The program continues in a moment. It's still Sound Health on Lagos Television, and today Dr. Idayat Durojaiye, a consultant obstetrician and gynecologist, will diagnose and treat polycystic ovarian syndrome. Welcome to the program, Doctor.
Thank you very much for having me.
Okay, to start with, what happens when you have polycystic ovarian syndrome?
Polycystic ovarian syndrome is a hormonal problem. It's an endocrine problem, and it's the commonest one affecting women in the reproductive age group. It's usually characterized by irregular menses. Sometimes they go for periods of up to 6 months without having a menses, or it also affects women who may be trying to conceive and are having difficulty. So basically those are the commoner things associated with polycystic ovarian syndrome. That's usually what triggers women who have polycystic ovarian syndrome to seek for medical help.
Aside irregular menstrual cycle, what are the other symptoms you experience when you have this disorder?
Yes, women who have polycystic ovarian syndrome could have other physical features such as increase in weight, presence of male pattern sexual hair, meaning they'll have a beard, could have chest hair, hair at their back, hair on their tummy, and then usually, the female pubic area, the hair distribution is usually triangular. But for women who have polycystic ovarian syndrome, they have it in a diamond shape, just like the men. So essentially, they're having male sexual characteristics, so to speak. So some will have reduction in their breast size from what it was previously. Some would have acne. That's acne. I think that's straightforward enough. And then they could have oily skin, and it could be a source of worry for these women. So they will seek help. Okay. Basically, those are the physical things a woman who has polycystic ovarian syndrome can have.
Okay. Can polycystic ovarian syndrome be hereditary or caused by lifestyles?
Yes, polycystic ovarian syndrome could be hereditary, as it has been found in women, in families, that's in women in the same family from their genetics. Also, it could be from environmental issues like lifestyle modifications, such as taking a lot of fatty food, fast food. Those can also lead to obesity, which could be associated with polycystic ovarian syndrome. So it can be both environmental and genetic in origin.
Okay. How true is the fact that it cannot be cured but only managed?
Yes, it's true. Polycystic ovarian syndrome cannot be cured. It can be managed. However, with lifestyle modification and treatment, you could have a significant improvement in the well-being of the person, such that once she understands how to live her life, then she will deal with it without having to take any medications, without having any risks. But that's if she manages her condition well. Sometimes with some medication, the hormonal imbalance reverses back to normal and she carries on with her life. But otherwise, she may need to do some form of treatment or the other to achieve her goal.
Okay, Dr. Durojaiye, earlier you said one of the conditions or one of the symptoms of this disorder is menstrual cycle, and we all know menstrual cycle is one of the factors, we regard it as one of the factors that make a woman pregnant. Can it make a woman infertile?
Very commonly, one of the commonest causes of primary infertility, that means someone who has never been pregnant before, is polycystic ovarian syndrome. And depending on what the patient is interested in as at the time she presents to her primary care physician or the gynecologist, is what will determine what will be done for her. So for example, someone is having irregular menses and she's evaluated and assessed, and the major problem she has is irregular menses. She can be treated and she'll be given some hormones in addition to lifestyle modification like weight loss, exercise of 5 times a week to improve her status. So with the hormonal treatment, her menstrual cycle could be corrected. But also there is this clarification that needs to be made. Someone not menstruating regular is not equal to infertility, although it's expected that someone having regular menstrual periods will be fertile, but it's not absolute. So someone who has irregular menstrual period may still be fertile and not have any fertility issues. So it's important to determine the cause. So anybody who has an irregular menstrual period should have an assessment with either a primary care physician or a gynecologist to determine what the cause of the irregular menses is, so that once the cause is treated, if it's polycystic ovarian syndrome, it may go back to normal. That does not mean that she will not be infertile from other causes.
Are there any health conditions that can make you have this disorder?
What is likely to happen is that from this disorder you have other health conditions. So other health conditions that could affect you because you have polycystic ovaries would include being obese, which is one of the problems because they have excess androgens. This is the male sexual hormone in their system. So they have excess male sexual hormones. So what they're likely to have is obesity, like I said. They could have hypertension, they could have diabetes in later life. Those are the commonest causes. And if polycystic ovarian goes untreated, it may put you at a slightly higher risk of having endometrial cancer. Slightly higher, it's not enough for you to call it a cause of endometrial cancer, but it makes it slightly higher than the normal population without polycystic ovarian syndrome.
What about use of contraceptives? Will it increase your chances of having polycystic ovarian syndrome?
The funny thing is, contraceptives can be used to treat this disorder, so it's not likely to increase your risk of having this disorder. Before we go on, usually polycystic ovarian syndrome has to be diagnosed. And usually diagnosis is irregular menses, like I said, increased male sexual hormones, and the last one is ultrasound finding of polycystic ovaries. This will be done in the radiological department where they carry out an ultrasound scan and polycystic ovaries will be seen. So this is what will combine. So depending on what you want to treat or what part of the problem is requiring treatment, because some people have polycystic ovarian syndrome and they accept it, and they live their regular lives with it. It's just they have certain conditions, like someone being AS. It doesn't mean there's anything wrong with the person, but she just knows she's AS and she moves on with her life. So depending on what problem the polycystic ovarian syndrome is given to the patient is what determines the treatment. So for example, someone who only has menstrual issues, like a young lady, 16, 17, still in university, not interested in having a baby, what her major problem is her menstrues are irregular. So counseling is important. It goes a very long way, letting the person understand what condition they have and then what their options of management are. So weight loss, for example, just 10% of current weight loss at the time of diagnosis could help restore normal menstrual function. And it said that sometimes just that weight loss would induce ovulation, which is what really causes, which is what the problem is with polycystic ovarian syndrome. These women are not ovulating, and if you are not ovulating, you have just a lot of estrogen, no progesterone that induces the menstrual cycle. So it's important. So for someone like that, just menstrual regulation may be all she needs, and she's fine. But for some other people who have menstrual issues, but with the treatment they didn't get better, once they know that okay, not menstruating and being fertile are two separate things, they may be accepting of the fact that they're not having regular menstrual cycles and move on with their life without treatment.
Will polycystic ovarian syndrome make a pregnant woman experience miscarriage?
Yes, so when you have polycystic ovarian syndrome, you're at a higher risk of miscarriages when you do get pregnant. But that risk is only in the first 3 months of pregnancy. But with medications and support, you would scale that hurdle and continue your pregnancy like every pregnant woman. The only other thing is that maybe during the pregnancy you'll be screened for diabetes mellitus, which is likely to occur with a higher frequency in women who have polycystic ovarian syndrome. So that will be done and then managed as is required.
All right. Aside miscarriages, what about fibroids and other health conditions?
Well, the risk for uterine fibroids are different. It's not necessarily sine qua non. That means they don't usually come together. So if she's at risk of having fibroids, she will have fibroids. If she's not at risk, she won't have it. But it's not that it's a polycystic ovarian syndrome that is causing her to have uterine fibroids.
Okay. It has no cure. What about hormonal therapy or hormonal replacement therapy? Is there any correlation? Will they be of, or can they be of help?
Okay, so the problem with polycystic ovarian syndrome, like I mentioned earlier, is that they're producing more estrogen, no progesterone. So in the normal menstrual cycle, there should be a balance. Estrogen produced in the first half of the menstrual cycle and then progesterone subsequently. After progesterone goes away, then the menses comes. But for someone who is having polycystic ovary, she's just having estrogen all the while, no progesterone. So hormonal treatment is one of the things that could be done to help them have, give them synthetic progesterone to help induce a menstruation. For some people, with that treatment, their cycle will be corrected and they start ovulating and producing their own progesterone, so they won't need support. However, if you are not producing progesterone on your own, despite treatment, if you don't end up producing, so why it's important is that so you know that okay, I'm not doing well on my own, I'll need treatment. But because hormonals have their own side effects, it's not safe to give someone exogenous, that means synthetic progesterone, indefinitely. So you only give it for a while. If it works, fine. If it doesn't, that's where counseling is very important. So once a woman is counseled and she comes to accept that that's how her body is, then she's likely to cope well with having polycystic ovarian syndrome.
Can diet and exercise actually improve polycystic ovarian syndrome symptoms?
Yes. Yes, diet and exercise is very important because with this Western civilization comes the baggage that they come with, the bad food, poor eating habits, eating junk, taking foods with high content of saturated fats, taking all fizzy drinks and lots of sugars and all. that increases your risk of having obesity, which is one of the problems associated with polycystic ovarian syndrome. So definitely with diet, exercise, lifestyle management, you would be treating polycystic ovarian syndrome by yourself. That's self-care, self-help.
What is the way to go if a woman has been diagnosed of polycystic ovarian syndrome?
The beauty of that is, how did you know you have polycystic ovarian syndrome? Was it that a doctor told you, or you just did a scan and they said you have polycystic ovaries? Because it's not absolute. You could have polycystic ovaries and not have polycystic ovarian syndrome. So it's when you have the hormonal imbalance associated with polycystic ovaries that you could say, yes, I have polycystic ovarian syndrome. So that you have polycystic ovaries doesn't mean you have polycystic ovarian syndrome, but it can be managed. Lifestyle modification, treatment, that's regulation of the menstrual cycle with the use of hormonals, helping you to get pregnant. So if you are not ovulating, for example, some drugs could be given to help you ovulate. And once you ovulate, your fertility issues may be solved that way. So those are ways to manage polycystic ovarian syndrome. But like I have said, and I need to keep reiterating, counseling by the healthcare practitioner is very important, because that way, once you understand what your body is or what your body is doing, you're more likely to live with it and live well with it and live well around it. And you don't have to tell anybody if you don't want to that you have that problem. Since you know the problem, you know what to do, you know who to seek help from, then you live your life healthy like everybody else. So it shouldn't be an issue.
Okay. I would like you to clarify the difference between polycystic ovaries and polycystic ovarian syndrome.
Okay, so in making a diagnosis of polycystic ovarian syndrome, there are three major things a healthcare worker would look out to make the diagnosis. First is you having irregular periods or no periods, or you're having problems getting pregnant. That's one. The second is either a laboratory test or there are signs physically that the woman is producing excess male hormones, that's excess androgens like testosterone and the likes. So that's the second one. And the third one is an ultrasound finding of polycystic ovaries. That will be done at the ultrasound scan. So when you have two out of these three findings, then we'll say yes, you have polycystic ovarian syndrome.
From your experience, Dr. Durojaiye, how aware are Nigerian women about polycystic ovarian syndrome?
It's difficult for me to say because I'm in a teaching hospital. So women would have seen their primary care physicians before they are referred to the hospital. But generally, I think the more enlightened you are, the more likely you are to know that there's something about polycystic ovarian syndrome. So I think the knowledge of people, maybe those are more educated, I would say, I can't say for certain, but maybe those that are more educated understand it more. Maybe because they visit the hospital more, they're likely to do more tests, laboratory tests and ultrasound scans to try and find out what the problem is when they're, unlike someone who is maybe on the low socioeconomic side, who is not likely to do tests until she's told to do one by a healthcare practitioner.
As we wrap up this segment, what is your advice to women about polycystic ovarian syndrome?
Yeah, so women should be aware that there's a condition called polycystic ovarian syndrome, but having this condition is not the end of the world. It can be managed, it can be treated, and your fertility may not be compromised with good management. So it's important to understand that as well. 2, lifestyle modifications. Stay active. That's the major part. Stay active. If you are active, the likelihood that you'll be obese will be much reduced, and the likelihood that it would affect your menstrual cycle will be more reduced. So staying active is very important. And the third is, if you have any medical condition, seek help from a proper healthcare professional. Don't go to the wrong places to seek help. If you need help, go to your primary care physician first. If you see a good primary care physician, he will identify your problems and send you to whoever you need to see. So that is important for people with polycystic ovarian syndrome and for women generally. If you have a problem, don't ask your neighbor who may have had something similar. Ask a professional who knows what they are doing and whose job is to make sure that you live a healthy life.
This is where we say thank you on this segment. Thank you so much, Dr. Durojaiye, for sharing your expertise with us on how to manage polycystic ovarian syndrome.
You're very welcome. You're welcome.
That has been Dr. Idayat Durojaiye, consultant obstetrician and gynecologist, diagnosing polycystic ovarian syndrome. Sound Health continues with trending and home essentials. Please stay with us. Are you experiencing irregular menstrual cycle, recent weight gain, and masculine hair growth? See your physician today. It could be hormonal disorder, also known as polycystic ovarian syndrome. This is why we say thank you on this episode of Sound Health. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.